All right, so this is part 2 of female reproductive anatomy. As I was saying, this is representing the inside of the organ, and then the pink was for the outside. So this, we are gonna go ahead and label the uterus. So in here, writing uterus, so this will be the inside. Again, this is the outside. The top portion of the uterus, the part that kind of sticks up above the rest, I've actually seen this term before in the stomach. This is the fundus of the uterus. So fundus is just a term for part of the organ that kind of sticks up a little bit higher than the others. Now, when it comes to the uterus, we have different layers of the actual tissue. So we are going to go ahead and label those. I'm going to start on the very inside layer here. And go like that. This is called the endometrium. All right, and the endometrium, again, we're just going to write that it's the inner layer. All right, so the very inside. And this is the layer that what we refer to as sloughs off, right, or kind of sheds during menses. All right, and then this main middle layer right in here, go like that. This is called the myometrium. If you guys don't remember, myo means muscle. So this is just the muscular layer there in the middle. And then we have the very outer layer of the uterus, the perimetrium. And we're just going to write that it's the outer layer. All right. So what we can do is we can kind of put a bracket around these just to remind ourselves that we went ahead and labeled the layers of the uterus. All right. So this is where, right, if we have fertilization of an egg, that'll come down and it will implant itself here in the uterus, and then it can grow into a fetus. So the next thing we are going to go ahead and highlight is this right here. All right, so this area right here represents the vagina, right? Or so the vaginal canal comes up here and then becomes the uterus up here. Now, in between the vagina and the uterus, I'm going to take a black and I'm going to kind of make a darker line kind of separating these two. Okay, that represents the cervix. Now the cervix stays closed until you are about to give birth. This is what opens and dilates so that baby can come out. The last couple things that we need to highlight here are just kind of some extra ligaments that kind of hold everything in place. So I'm going to start here. I'm going to take a purple and I'm going to highlight these two kind of bands right here and right here. Okay, these are called ovarian ligaments. And again, they are just there to help hold the ovary kind of more in place, making sure that it doesn't go anywhere that it doesn't need to. And then the last thing we're gonna highlight is the kind of these squiggly lines right here. It's another ligament. This is called the broad ligament. Again, just another ligament kind of holding everything for the female reproductive system in place. And there you have it. That is our basic female reproductive anatomy.